I don't know why I tried to switch my screens, but we are live. Good
Great.
evening. How are you doing, Kaman?
I'm doing good. How are you?
I'm doing well. All flustered. I don't know how I messed up starting this at the wrong time and then forgetting to set up everything. But we are here, and I'm doing well. I'm doing well.
That's good.
So happy for everyone for joining us. Be sure to subscribe, leave a like. Be sure to follow both of us on social media. Our links should be in the descriptions, and share this with someone who will get some value from it, because I definitely think it's going to be an interesting episode or interesting live. And feel free to drop any questions you have in the chat as well as let us know where you are tuning in live from in the chat right now.
Yeah, I'd be
We
super
appreciate
curious
that.
to know.
Yeah. Same here, same here. So would love, I know I've had you on my podcast before, but I would love for you to just give a little refresher of everyone, as well as it's been a while since I've had you on your podcast. So a lot of things have happened. So give a little brief background about yourself, the work that you do, and yeah, we'll go from there.
Yeah. Hi everyone. My name is Kaman. I use she, her pronouns. I believe I was on your podcast last summer and I was like talking about school related things. I think for like students who are interested in going into the MPH program and how to do that. But since a year ago, I have graduated from the University of Alberta with my master's in public health and health policy and management. And I'm currently working at an affordable housing organization as a policy and research analyst. And then other things that I have been doing is related to public health, at least, is running my public health Instagram account, which is Cayman.mph. And then also a new venture is I'm starting my like public health consulting business, actually with one of my classmates that I met through the program. So we are currently doing that too, and that is also really busy. Yeah, that's just like I guess a little bit background on me.
Yeah, that was awesome. Well, congratulations on that,
Thank you.
as well as congratulations on working with your friend to start this consulting business. I thought you were going to announce that, like, you're on TikTok, because, like, I look at you on TikTok, I'm like, yeah,
Yeah.
yeah, Cayman, you do that, because I am not doing that right now. But be sure to follow Cayman on TikTok as well. But that's awesome. And maybe if we have some time towards the end, we can talk a little bit more about that. But appreciate you sharing that. And I know I wanted to bring you on both because we all love you and the great work that you do, especially on your Instagram profile. But I know that you were going through the process of applying for jobs, especially as like an early career professional in public health. And I think like it's important to get those kind of insights from people in the work right now to hear what's really going on. So looking forward to that. Before we get more into that, I believe it was a one of your LinkedIn newsletters, it might
Mhm.
have been, or it might have been on your Instagram profile, but you spoke about what counts as public health experience, because a lot of people, especially students, have a hard time grasping what is public health experience, what they can write on their resume, what they can speak to public health experience. So I wanted you to chat a little bit more about that some more.
Yeah, I actually love that question and like that topic specifically because I think sometimes when people think about experience, they're mostly focused on just job experience. So where you're getting paid to do some sort of a task. And I think if we start looking at experiences very holistically, so looking at lived experience, looking at volunteering experience, looking at non-paid experience, practicum experience, coursework experience, there's so many different ways that people have already been involved within public health. And so, for example, before I even got my bachelor's in public health through the University of Lethbridge, I was doing my BSc in general science at Martin University. And that was when public health was first introduced to me. And so I had no idea what really the field was besides something to do with epidemiology and something to do with Jon Snow. And that was mostly my context. And I didn't really know how do I actually get into it. So when I was looking into applying for public health programs like master's levels programs, they kept talking about, oh, we're looking for people who have this public health experience. So I was like, okay, how do I like go about getting this experience and like making the committee love me enough to even accept me into their school. And I was talking to one of my mentors at the university, and she actually ended up getting her MPH from Queen's University in Canada. And she was telling me about how even volunteering might be a really great way to, gain some experience. So actually, what I ended up doing through the university is that we had like a peer health educator program, where basically I was a peer health educator, and I would go every month, come up with some sort of like a health education program, whether it was on healthy eating, sleeping, sexual health, whatever the topic that was assigned to me. And I would come up with some sort of a program and educate students within our big corridor hallway, and just kind of like do that one-to-one health promotion, knowledge translation type of work. And I talked a lot about that in my letter of intent. And that was my first step into, gaining that public health experience. And I think once you start somewhere, even if it's in volunteering, you end up meeting people who can connect you to other experiences. So from there, I ended up sitting on like a health committee for the university, where we talked. I think at that time, Canada was thinking about passing legislation on cannabis and making that legal in Canada at that time. So that was a hot topic at the university because, how are we going to handle this, and what is that going to look like for students as well? So I got to sit on that and put my 2 cents in on behalf of students at the university. And then from there, you still build those strong connections. I was offered a part-time job where I was a health promotion research assistant. So that's that sort of experience that you get, but even lived experience counts as experience. There's some people every day that experience a lot of like health structure barriers, or kind of like any systemic issues, and often do advocacy work. And so your advocacy work that you're doing, whether it's for yourself, for others, for your community, those also count as experience. And so I think thinking about your life and all the different experiences that you've had very holistically, and not really tying it to like a job title, is really, really important, because I think we all have experiences. And I think all of us probably have experiences, especially because of COVID-19, and that being a really big public health emergency and all of that impacting our lives. There's probably lots of different things that we had to do to take COVID-19 restrictions and policies into consideration when we're doing our own job or, living day to day. So yeah, I think thinking really holistically. Hopefully that answers that question.
I absolutely think so, and I think that was like the perfect answer, and I feel very similar in the sense that I didn't have much experience going into my MPH, going into the MPH. I just had like volunteering experience in different hospitals. But that was information that I was able to translate into like more public health, or understanding things from like the patient's perspective, and like kind of speaking to that as an experience in itself. And I think a lot of the times we do have experiences that we do, whether it is from volunteering or engaging in like a student organization or whatever the case might be, that are things that we can talk to. And it's interesting that you brought up the point of lived experience being real experience, because I was on a panel yesterday, and they were talking about, okay, how do we get increased diversity in local public health? And one of the things that they're thinking about is like, how do we like disrupt barriers so that people lived experience is something that is valued just as much as education, so that we're actually getting into the root of the cause and really ensuring that we have community at the table, which is all interesting in itself, and I think very important. And I'm glad that you highlighted that. Shout out to Rachel, who's in North Carolina. Yeah, I'm in North Carolina as well right now. And then we also have Sierra, who's a first-year MPH student at University of Washington. So shout out to you as well. Be sure to let us know where you are viewing this right now from, or if you're watching the replay, let us know where you're viewing it from also. And leave a like and share with someone who's going to get some value from this, because we're going to dive into some more public health, applying to public health schools, which I think is going to be valuable, especially in today's setting, which I think is important to hear about. Okay. So you recently, or at least decently recently, started this new role. And I know previous to that, you were applying to jobs, and you wrote a post around applying to 25 jobs before getting your current role. Before we dive like deeper into that, I feel like in public health, a lot of people have difficulty figuring out, okay, what should I apply to? Like I like these kinds of things, but how did you like narrow down the types of jobs that you were looking for, and just thinking about like where in public health, or how did you think about that looking for a job?
Yeah, that's like a really great question. And I think for me, and I know my experience or like my decision making might be unique to me, but it might apply to other people as well. So the first thing I thought about is what actually about public health really interests me. Is it, talking about communicable diseases? Do I want to be in environments where I'm working in the hospital? Do I want to be in environments where I'm in an office setting, in the community, health education? Like, what are all the things that actually align with my goals, where I see myself, and what am I actually good at? And so I really thought hard about all of that because I feel like I'm one of those people that are multi-passionate. I care about so many issues. I care about so many topics, and you can probably spark my interest in literally anything. And I will take the time to sit and learn. And so because I'm so scatterbrained sometimes and I think about a lot of things all at once, I needed to kind of find my focus in an area where I knew I would stay passionate and I knew where I would learn lots. So for me, finding a job is about a topic that I'm interested in and if I will learn a lot. And I guess a really great example of why I am the way that I am is like I've worked in lots of different sectors before going into public health. And for example, I worked in banking for 2.5 years. And the only reason why I worked in banking is because I like money and I wanted to learn a lot about how money works. And so those are the two reasons why. And as soon as I felt like I learned enough, I left because that's just the way that I work. And so when I was thinking about post-graduation and what I wanted to do, I knew I wanted to get into a job that would at least prepare me enough where I would be working on multiple different projects, doing a lot of different work every single day, and I'd have the opportunity to meet lots of people. And that sounds very broad, but those are my three goals. And so since my MPH was in policy and in management, I was more interested on the policy aspect. And because policy can be so diverse and you can work in literally any area and do policy work, I wanted to see what was out there. So for me, I think I was specifically only applying to like policy analyst jobs, and I was applying to maybe like project management jobs. Those are the two things or the two titles I would say I was looking at. In terms of where I was looking to work, I also had set goals for myself in terms of salary, and I was also setting goals in terms of myself, in terms of like what the organization itself was focusing on. So for salary, for example, and just to be like, I guess, transparent about that as well, I knew that I didn't want to accept anything less than $80,000. Like I was not accepting a job that was going to pay me less than that. If it met 80 and above, I'd be a lot happier. And that's for a lot of different reasons, inflation, my life, and like things that I want to save up for in the future. So I was also only narrowing down jobs where it would pay me what I expected, at least for the range. And if it didn't have a range posted, I would apply and like see what happens. But that's kind of like where that was at. In terms of topics, I knew that I didn't want to be in government anymore. So prior to working in affordable housing, I was working for the provincial government, and I was doing data analyst work, and I enjoyed it for probably the first 6 months. But after a certain point, it started feeling really repetitive to me. And I was not really doing public health work. I was doing public opinion research, and I found it super fascinating. But once the government priorities kind of shifted away from the COVID-19 pandemic, and the public opinion research that we were doing were focused on other topics, I became a little bit less interested in the work, and I knew I wanted to shift my way back into health somehow. So I also, and I knew how governments work in terms of salaries and pay scales, and I was like, government clearly isn't for me for my goals that I have that are kind of outside of just like thinking about public health jobs. And so I was looking always outside of government. And looking at cities and provinces that I would be interested in living in. That was just kind of the other thing too. And I knew I wanted it to be in Canada. And I also wouldn't have minded if it was like 100% a remote opportunity. So I was also only looking at remote opportunities or hybrid opportunities. I didn't want to be in office full time. So those were kind of like my criteria that I set up. Once I set that up, I would look at LinkedIn mostly and Indeed, and I would use policy analyst, health or health policy analyst in the title, or health project management or health project manager or project manager in the title. And I also kept it very broad. Sometimes I would take out health, because I think the other thing that folks should really focus on is, if you're looking at like health policy analyst jobs, you're going to probably find those 90% of the time in, at least in Canada, like speaking from that context, would be at a government level, because there's like the Ministry of Health, or if there's, depending on the province that you're in, if there's like a huge health organization, you'll probably find a job in there as well for a health policy, like an analyst. But I didn't want to do that. I wanted to kind of scale down smaller and kind of go more on that private sector, because I knew A, would pay me more, and B, I'd probably get a lot of work piled onto me. So I'd gain a ton of experience within the first couple of years of just working there. So that's kind of what I wanted to do. So I would search very broadly, and I will say that I applied to even jobs at like TikTok, for example. They were looking, I think TikTok Canada was looking for a policy analyst, and I read like the job description, and they were actually focusing on like mental health policies that they wanted to integrate into the organization, but also like across the platform. And I thought that's really cool, and I would totally be somebody who would love to like work for a social media company and like do stuff like that, because whoever gets the opportunity to do things like that. I also like just like random jobs that I applied for. I think I also applied for a job with Google Health at some point, and they were looking, I think that was more data analytics. And since I already had like the background in it, I thought, okay, might as well and like see what happens. And then for my current organization that I applied for, I actually didn't find this job posting myself. One of my really good friends slash business partner, she knew that I was interested in affordable housing, because I knew I didn't want to work in communicable diseases. I knew I didn't want to like work in like really health related things, and I wanted to do more social policy and really focus on like the different social determinants of health, because that's kind of where my interest lies in. And she found this job posting, and she's like, hey, it's within your pay range, and it sounds exactly like something that you would be really great at, so why don't you apply for it? And she found that on LinkedIn, because we both had our like LinkedIn notifications turned on for any like jobs that might be up our alley. And I would say that in terms of the process, I was looking at jobs daily, like lunchtime breaks. I would be on LinkedIn or on Indeed, and I'd be like looking up to see what like the new job postings were. And then I would collect all of them, because I know on LinkedIn you can like save a job posting. So I would save all of them for Friday, unless the deadline was before then. And I would apply for like 10 or like 5 or 2 or how many ever I found that week, on the Friday, and hoped for the best, basically, and hope that they would get back to me. And I know that 25 might not sound like a lot for some folks, but like I said, I was very specific in what I wanted. And not every job met my criteria. So I was very picky, and I would say I was in a very privileged place to be picky, because I still had a job, and it's not like I was looking for employment right away. So I didn't hate my job. I would have stayed there for way longer had I not found something that I liked better. So I hope that answered the question. It was a very long answer.
No, but I love it, and there's so much to take away from that. And I'll try to remember
Yeah.
everything, all the good points that you said to try to hit on, because I think that answers a lot. And I just want to firstly say, like, even if you're in the US, it's exactly the same process. You're doing the exactly same things. I like how you talk about like going broad and then figuring out, okay, I wanted to apply for policy analyst positions, and just like getting deep on that and understanding, okay, from the research that I've done, from looking at a bunch of different roles, these are the types of roles that I'm doing. I also like the intentionality and everything of like considering, okay, I want to work somewhere where you said you have strong passion as well as you learn a lot, and then you have multiple projects, so you continue to learn as well as the opportunity to network and meet people. And I think being able to just say these things, a lot of people, even after they graduate, even when they're working, they're not intentional enough to say, these are the things that I want in an organization, and try to seek them out. So I think it's really awesome, and it's a great example that you're sharing this, and like being very intentional as well as setting your salary goal. I think that's something we all in public health should be intentional about, and understanding that sometimes the path that we thought that we were going to take, it doesn't match with the what we need for our life to be comfortable, or whatever, matching with the goals going forward. Also really love the point of you saying you had experience working with the government, and you were working with the government before, and you realized what that work was like, and you realized it was not for you. And on top of like the knowing that the salaries for those you can find those online, especially coming in as an entry level position into any type of government, whether Canada or the USA, you know that you're not going to get paid your worth in a lot of cases. Sorry to say. And I hope that that does change, but I think like just being very intentional in everything that you did to get and narrow down. And yeah, 25 jobs is a lot. Maybe it's not a lot to a lot of people, but I think just regardless, I think it's important that you had a formula or a way to like set up, okay, these are the things that I'm looking for, and how can I best approach this. And I think it's also commendable on your side to say that you're coming from a place of strength of, okay, I'm not waiting till the last minute of my program to like look for a job, but I have this job that I have right now. It's not the best thing, but it's not the worst thing, and I'm enjoying this. So I would stay here, but I'm looking for that other leverage. And yeah, please feel free to drop comments not comments, questions in the chat while we're talking as well. But before anything, I wanted to ask, like, how did you think about, what was your process of understanding, okay, job descriptions or job names, and then narrowing down? I think you said policy analyst and project management. Those were the two types of jobs. So what was the process for you thinking about, okay, there are all these different types of jobs, and let me narrow down on these types of jobs?
Yeah. So like policy analysts and I think project managers, there's differences obviously between the two types of roles, but there's also similarities because a lot of policy analysts, what they do is project management work. And in terms of, I guess, defining what these two like very broad titles mean. For project management, I was looking for roles specifically where maybe there was like a health program or some sort of like a community initiative, or I don't know, some sort of like a program that an organization was running. And I would be responsible for helping to lead the program, to make sure that it was organized, and, you know, connecting with stakeholders. And yeah, just like being in a position where I was making sure that this program was going to be like moving forward and leading forward. So whether it was using like project management tools, whether it was, you know, constantly being in meetings and like ensuring that everybody's like on the same page, and doing a lot of that communication work and doing presentations and facilitating, like those are the things that I was really interested in, because those are skills that, one, I know that I'm good at, and two, that like I have previous experience in, I guess, in like single instances. So for example, when it comes to like facilitating meetings and facilitating presentations, I have a lot of experience doing that because I was teaching for 3 years. And I know that if I can teach a classroom of teenagers or in like preteens on sexual health topics, I know I can run a meeting, and I know I can keep things organized and on track for professionals on a project as well. So that's something that I enjoy doing. So I knew I wanted to like do something similar to that, which is where that project management title came from. The other thing, I love seeing a program or a project from finish to end. Like I love doing that. I love being able to do things on a project basis, of like, okay, we're going to be running this thing for 6 months. Here's all the things that you need to get it done and get it done well and on time and on budget. And I love challenges. So if somebody gives me a challenge like that, like I put 100% of myself into it. And so project managers do a lot of that where it's like, okay, here are all of my resources. I only have 6 months to, run this program or something. And I need to get it done efficiently and well. And yeah, so that was like a big interest to me. And I was interested in terms of project management. I knew that I could either be in like a traditional healthcare role where it's like a traditional health, I don't know, program, or I could also shift a little bit into other fields like healthcare tech or like other, social policy or social programming adjacent type of roles as well. So it kept me available to, whatever I was interested in. Because for me, it's not really about the title at the end of the day. It's really all about the work that I'll be doing and also the team that I will be working with. And if I like those two things, you can get me interested in literally anything. Like as long as I see that I'm working with people that are like passionate about the stuff that they're working on, I'm on board. Let me learn and let me like jump in and like help out as much as I can because I know what I bring to the table as a professional and just as a person in general. And so that's where that project management came from. And then in terms of policy analyst, because I did my MPH in policy and management, I have a huge interest in doing like research in terms, and it's like it's quick research too. And I didn't want to be an analyst where I'd be working on one project for like a year, because I know sometimes that's what analysts do, and I will say especially in government, depending on the portfolio that you're working on. I knew that I wanted to be able to look at multiple different types of policies and like see how regulations come together. And policy analysts, I will argue, do a lot of systems thinking and systems design work because you're trying to figure out, here's this health issue. What kind of solutions can we as an organization come up for this issue? But then there's also external factors that you have to think about, which are like stakeholders. So how will they feel about us coming up with this policy, try to fix this issue? And then is there already existing regulation or legislation that like either will negate what we're doing or even support what we're doing? And then the other piece around that is what does like the academic research say about the solution that we're coming up with, the policy that we're coming up with. So you have to think about all these different factors as a policy analyst and come up with like a good solution to a problem. And you do a lot of problem solving there. And so for me, that was a big interest of mine as well, as I wanted to do problem solving and I wanted to organize things, I wanted to manage things, I want to work with other people. So that's where the policy analyst job title came from, and then also the project manager job title came from. And I feel like they're similar enough where I'd be getting to do problem solving and like organizational things and research and all of that stuff, but they're different enough where I would have been happy with either, or I guess job title essentially. I hope that helps.
Yeah, absolutely. And it absolutely, like going back to what I was saying earlier, to being very intentional and understanding like what you want from a role and looking and seeking out those types of roles. And it seems like you made sure to get experience in these different things so that okay, this is something that I like, or this is something that I'm passionate about, etc. So before we get anything, we currently have 13 viewers and only 8 likes. So please, everyone, like the videos so that we can get up to 13 likes, at least for now. I greatly appreciate that. We do have a really good question from Sierra, and it was around, did you ever feel discouraged during the job hunt? If so, how did you work through it?
Oh my God. Like 100% was super discouraged a lot of the time. So yeah, I think like something that people maybe don't talk about enough is like when you're transitioning out of school and going into the workforce, the real world after graduation, there's a lot of change that happens to somebody in a very short period of time. And I don't think school honestly really prepares you emotionally with that transition. So like when you start school or you start university, for example, you like go to orientation and you have like, maybe a week or 2 weeks, I don't know, of like orientation stuff, and people are very like kind and gentle and slow with you. And they really want to make sure that you feel welcome and integrated and like into the school. So you feel comfortable and you feel like you want to stay there. But when you graduate, it's like, here's your piece of paper. Good luck. Like, like, good luck. I hope we did a good enough job that like you're gonna just do what you need to do. And so I when I was applying and I, heard rejections or wouldn't hear back for an interview, or would not even hear back at all of like whether or not somebody even like took a look at my resume, I would 100% feel discouraged. And I think the thing that really did help is one, knowing that like I'm only applying for things that probably lots of other people are applying for. And there's also lots of other people out there that might be in the same position that I'm in, looking for a job and probably are more qualified. And that's okay. And that just means I have more time to work on my skills and more time to find something that's really meant for me. And I truly believe in how when something is meant for you, it will find its way to you. Like, and for this job, for example, that I got, I was telling my friend for months how I think housing would be such a cool place to work in. But I was not finding, like, I literally didn't find any like housing related jobs before, and I would barely find them. Alberta, that's the province that I live in, doesn't have like a big housing organization the same way that British Columbia does, and I think Ontario has one as well. And so it was a little bit more difficult to find like an organization that I would just like look for jobs for all the time. And I was telling her for months, like, I think housing is so cool because I was like, there's just so many different determinants of health that like fall into housing, and I would love to work in this area, but I just don't know if I'll ever will. And I kept repeating that, I think, for her for months. And the day that she like sent me the job posting, she's like, oh my God, like this totally fits what you wanted to do. She's like, you should apply. And when I heard back and like got the interview, and like a couple of days after the interview got the offer letter, like I had this feeling where it's like, yeah, this was 100% meant for me. Like I'm accepting a job where I know that I waited for something good for me. And honestly, I think it was in July or June, I was interviewing with the government of Canada, and I got to like the final stage of interviews. And the only reason why I didn't get it was because they messed up and they were only supposed to be interviewing people who speak French. And then somehow I like got
You
through
don't speak
that.
French?
I took
Just
French
kidding.
from like from grade 4 to grade 11, and then I just stopped after that. So my French isn't that great. I'm like really good at reading it, and that's mostly about it. But somehow I got like towards the end, and they really liked me, but they said they just couldn't hire me because of that, which I was like, whatever, like it happens. But I was so ready to accept that offer because I felt very desperate at that point because I was like, oh my God, I'm not good enough. Like, what's happening? And that like job was not like did not pay over $80,000. Like it did not meet any of anything that I wanted to do. I was just feeling at that point very desperate to just take something. But once I didn't get that job and I just like kept on applying for other jobs, I'm really glad that I just stuck it out until I found something that I'm honestly very, very happy in. And like this job really meets all of my needs in terms of what I was looking for a job. And I'm like very, very happy like where I am right now. So I think when you're hearing rejections, when you're not hearing back from people, the biggest piece of advice that I have is, and I know it sometimes sucks to hear it, is like be patient because there's something out there that is 100% meant for you. And I truly, truly believe that because yeah, if you're being intentional about what you want to do, you'll find it.
Yeah, I appreciate that a lot. And two things I just wanted to highlight there is the first one about like knowing that that first job did not meet what you were looking for in a job. And I think a lot of times when we are applying for jobs and we're getting a lot of rejections and a lot of failures, we're like, oh, are we actually as good for this thing as we think we are. And I think, like, to your point, it's yes, and you just have to continue to find that organization, find that role that you will fit into, and not be discouraged by those no's, because you never know when you will get that yes. So persevere there. And then I also appreciate that you brought back up the fact that when you were looking for jobs, you had all your job search on LinkedIn and on Indeed, but you were also telling your friends and sharing, these are the types of roles and the types of things that I'll be excited about. And from that, even though they had on all those job alerts, it was from a friend that this job was passed on to you. So I just wanted to highlight that for other people. Share what you're looking for. You never know who's going to be able to help you or anything like that.
A big shout out to Deb, because I know she's watching somewhere.
Yeah, shout out to Deb. Awesome. And we did have a next question, which kind of goes into the other topic that I was going to ask you a little bit more about, which is going to be tailoring a resume and cover letter tips. And I know we're going to do like a little bit of a live example of how you thought through the process. And before we get into that, Rachel asked, how do you get yourself to stand out compared to other applicants?
That's a really great question. And honestly, something that I'm still trying to figure out how I do that. I will say that I'm a significantly better interviewer than I am a resume cover letter person. I know that my strengths are 100% interviews and my weaknesses are writing my resume cover letter. So for me, my biggest challenge is honestly just standing out in the cover letter resume stage. And I think the biggest way that I do that is I really use keywords. So for like, actually, I think this might be easy to also just do like the live demonstration and then just like answer the question that way. I hope that's okay, Rachel. But I think your question really does like segue into the live demonstration. Let me share my screen. Where is it? Okay. Share. Can you see that?
I can see it on my side. They should be able to see it, I'm guessing.
I really hope.
This is my first time sharing screen.
I really hope everyone on live. If you're on live right now, and you're watching, can you comment if you can see this Indeed screen?
Okay, they can.
Okay, great.
There's a delay in it, and I just saw it change, so we are good.
Okay, great.
Maybe if you can zoom in a bit, that would be helpful.
Yeah, I'll do that. Let's see. Oh, it's not gonna let me, is it? I don't know.
If not, no stress. If not.
How do we zoom? There we go. Okay. Is this better?
Yes.
Okay, great. Where is it? So this is a random job that I found. It is Project and Policy Analyst at Berkeley Public Health in California. It's very, very random. But so the job is, for like a policy project analyst. This one I think is kind of like, through the university. Not 100% what you do here, but it says it aims to improve population health, especially for the most vulnerable through interdisciplinary collaborations. And this one, I think they're working through the Safe Transportation Research and Education Center. So if anyone actually has an interest in that, and they're hiring right now, so you might as well use all these tips and apply for it. Right. Okay, so for this job, they have like the list of responsibilities, and then they also will always have like a list of required qualifications. When I'm applying for a job.
You can go on. I was going to ask, like, so are those the things that we should focus on when we're looking at jobs from the beginning?
Yeah. So for me, I will read kind of like what the job posting is about, and then I usually will skip to the qualifications because that's kind of how HR, and it depends on like what organization that you're kind of applying for, but mostly HR will go through everyone's like resumes, and sometimes they will use like a program to see if there's like enough keywords that you might be kind of moved over and like your resume is passed over down to the hiring manager or like a hiring committee or however it's going to work at their organization. And sometimes it's like people, like a single person, no program, just reading through your resume. So I will always focus on qualifications because for HR specifically, I would know that this is like what the hiring manager told them that they needed in a person. So they're going to really look for those key terms and like words within your resume. So for example, like knowledge and or ability to learn common campus specific and other computer application programs, something that I would highlight in my application in specific in terms of like the resume or even the cover letter is I would talk a little bit more about any programs that I may have learned through university that university campuses often use. But I also will look through all of like, and this one has like a lot. This one has like, I really wish they bullet pointed it, but they didn't. So that's something that they should have done. But this one has like a ton of things to focus on. As you can see, I picked this one specifically because there's a very long list.
So how many of those different points do you think we should focus on, and like how many times do you try to reuse keywords in the resume, and how do you think about that?
If this one, like this one, for example, has a ton in it, I will look at all the qualifications that they have on it, and I will see if any of them specifically match anything that's written in the responsibilities. Because if it's written in the responsibilities and it's in the qualifications, it tells me that's really, really important for that organization to have. So I'm going to see something here. Let's see. I didn't look at this one beforehand. I'm like reading with everyone else right now.
Love it.
So this one, let's see, oversees and executes writing in collaboration with internal, external colleagues, publications, abstracts, or meeting summaries, blah, blah, blah. So let's just see if writing is really important. So then I'll go down to the qualifications and see if there's something in writing. Yeah, so there's strong communication and interpersonal skills to communicate both verbally in writing and effective for all levels of staff and collaborators. So that already tells me that I need to be a really strong writer or communicator. So in my resume or in my cover letter, I would really highlight that. So for me specifically, I would talk about any of the times that I worked on as like a research assistant, because through that, you often have to be writing reports. You sometimes have to put together presentations, whether they're like 5-minute presentations, 15, half an hour. And I would talk about, and I'd quantify all the times that I've done it too. If I have like a log or, you know, have a rough idea of how many times that I've done it. And if I've done it in every single like past role that I've had, I would make sure to highlight it in every single role that I've done previously, because then that would tell the HR person or whoever is reading my resume that, okay, she really has, like, she's not lying. She does have this many years of experience with effectively communicating or like developing reports or putting together PowerPoint presentations. And then the other thing that I would highlight specifically for this job, it says here, it's for all levels of staff and a broad range of external collaborators. So I would also highlight the different times that I've communicated to different audiences. So for example, in my previous role as a research data analyst, one of my top things that I was doing every week was developing like PowerPoint presentations for the Premier's office or like executive leadership teams. And so I would say, I don't know, like developed research insight, I don't know how many like PowerPoint presentations for executive leadership team or Premier's office or, you know, whoever. So then the person reading my resume can see, okay, not only does she have experience in developing these, you know, communication tools, but she also does it often. And she also is able to communicate to higher level of like authority within an organization. Because then people know that for executive leadership teams, for example, they don't want to read 15-page reports on whatever. They want quick, short summaries so they have the information that they need and they can move on and make a decision. And then in a different job, I would talk about, or a different previous experience that I had, I would talk about times that I have written long reports because I have done that before. And so I'd highlight, I don't know, like developing research presentations or reports for scientists or I don't know, like whoever my audience was at the time. So that's for that specific key point, that's how I would translate that into my resume. For the cover letter, I would say a little bit different. So for cover letter, I would also look at whatever's matching. So I would look at whatever's in the roles and responsibilities if they have that section on the job posting and see what kind of matches down in the qualifications. If nothing matches within the qualifications, I would say I would try to take the ones where they highlight it heavy. And most organizations I feel are organized enough, or HR is organized enough where they'll write like the more important qualifications kind of like at the top. So sometimes it'd be like, oh, we need somebody who has like this many years of experience with project management or leading programs. And so I'd make sure that like, okay, that clearly is probably a really big part of that person's job. So I will make sure that I write that in my cover letter and highlight it all the times that I've done it, whether it's big projects or small projects. I would highlight that within my resume as well. And I really want to stress the fact that when you're writing about yourself, write about yourself as if somebody else is writing about you. So you might think that like, I don't know, working on some sort of a project that was like a month long with like one other person wasn't really a big deal because that's what you do on a day-to-day basis. But if that was me knowing that, oh, wow, you put together like, you know, this entire health program with just one other person, like that's so impressive. And you only had a month and like that's what your resources were. And you still pulled that together. Like that sounds like a really big accomplishment. So I would make sure that I would highlight those things within your resume. And the one thing that I did a lot to make sure that I remembered everything that I was doing in my job, because I know that sometimes you forget because time goes on and sometimes it feels like day-to-day work, is I ended up creating like an Excel spreadsheet log. So every time somebody asked me to do something, I wrote down who asked me, why did they ask me, if it's related to some other project within the organization. So it was my part, like my contribution to that project, and what exactly did I do and how long did it take me to do it. So when I was like applying for jobs, I could go back to my little spreadsheet and it'd be like, oh, cool. So I've done, 10 presentations in the last 2 weeks. And I did it for all these different audiences. And this is how long it took me to do all of these things. So I could have this information for when I start interviewing. I could like talk about that in like a bigger way. And I also would keep, every time somebody told me that I did a great job, I would keep note of that, of like, what did they tell me that I did a great job on? And so when I would go into like my interviews and people would be like, oh, like, what do you think is like one of your biggest accomplishments? You might not think that was a big accomplishment in your last job, but your boss sure as hell did. So you might as well talk about it in your interview. And so, yeah, those are kind of like the things that I was doing to help prepare write my resume and my cover letters, but also how I would start filtering out what is actually the most important thing to actually highlight in like a job. I hope that answers the questions. I'm also open to taking more.
Yeah, so yeah, feel free to drop your questions in the chat if you do have any questions while we're here right now. But just to like reiterate a lot of the things that you said there, looking at the job posting, looking to see what in the qualifications matches the responsibilities, and then try to focus on those types of things in your resume. For the cover letter, more focus on what roles and responsibilities match the qualifications and speak to that. I also like the point that you said, like when you find out those keywords and the things that are important in the job, which are most of the time higher up in the bullet points that they have for these different sections, is to add them to each different position that you've been in some way, which I think is important. And that's awesome that you have a spreadsheet that keeps track of all of that, which I think is also very important. And another question that I wanted to ask is, because earlier you said you applied on, I think Fridays it was, what was your process for like batch applying and saving the information from the different places that you applied for? Because I think that's also something that a lot of us lose track of while we're looking for jobs. You might forget to save the job description, and then you want to speak to it better in the interview. So like, what was your process for applying to companies and like saving that information?
I have a job tracking spreadsheet. So in the job, so it's like on my Google Drive. So basically there's like one folder that's like titled job postings that I applied to. So anytime I would apply for a job, I would copy paste. Because sometimes they like take the link down, so you don't want that happening. So I'd copy paste the entire job description and I'd put it on like a Word doc. I would title it whatever the title is, and the company, and I would save it in there. And then on my job tracking spreadsheet, I would have one, like my first column would be job title. Second column would be company or organization name. Third job title is closing date. So I knew kind of exactly when the posting would have closed. Reason why I chose that was because typically companies should get back to you within like 2 to 3 weeks. So then it kind of gave me a reminder of like, oh, I haven't heard back from them in like 4 months. I should probably just say that they like didn't, look at my resume at all. So I used closing date as like just a marker for myself to remind myself that, oh, I might be hearing back from somebody. And then because for policy analyst jobs specifically, I would say you often had to do written assignments. So either you like got an invitation to do like here, write a briefing note on this topic and hand it back to us by this time. Or they would interview you first and then do a written assignment. So I had a column of did they give me an assignment? Yes or no. Did I do an interview with them? Yes or no. And then I also had a column of what did I apply with? Did I apply with just my resume? Did I apply with a resume and a cover letter? Did they have their own weird online portal thing that I had to apply for or apply through? So I kept track of all that. And then for the job title column, I would link my Word doc with like with the job posting on it to that word, or like I guess that title. So then I can always go back and like see what that job posting actually entailed. Reason why I kept them is because when you do get a chance to do an interview, or you finally get a phone call and it's been like a month later and you're like, what the hell did I apply for? Like, what was that? At least you have that information in front of you. And so, and then it's easier so you can prepare yourself for the interview a little bit better as well, to know like maybe what key things that they're actually going to be focusing on. And every interview that I've ever gone to has always asked me, why do you think you're so great for this role? Or like, what would make you a great asset onto this team, or something like that. So I would take keywords and like key points that they put into their own job posting and make sure that I highlighted those in those questions. So then I fit the criteria that they're looking for. So that's how that worked. And then when I was actually applying, and I know that some folks just have one resume and maybe like one generic cover letter, and then they'll like change the titles and all that's like finesse it that way and then send it in. I never did that. I really, because I was being intentional of where I was applying, I really took the time every single time to tailor my resume. And I really took the time every single time to write a new cover letter. I had like a skeleton of what I would use, but then I would go comb through the like the posting, and I would comb through my resume, and I would also comb through my cover letter. And I've always had managers that told me that if they never saw a cover letter attached with their resume, they do not look at your application. So that scared me enough to always apply with both. Yeah.
Yeah, absolutely. That makes a lot of sense. And I think you could stop sharing. We do have two
Okay.
questions that I will ask you before we wrap things up. And I feel we could have another conversation just around like the interviewing
Oh,
and
yeah.
how to think about that. And maybe that's something that we can do in the future. But just so we don't have to hold you here for too long, the first question from Jewel is, do you think there are entry-level public health positions available for those without a graduate degree, but are in the process of applying to programs?
Oh yeah, 100%. And I think this is where your creativity comes in, because some folks, when you're applying, maybe like type in public health jobs into Google, and then yeah, for sure you're going to see public health jobs. But you're missing out on all of the jobs that are like public health adjacent. And I think that sucks because a lot of the time, like public health adjacent jobs, you build so many different, like a unique skill set. So when you're actually applying for like, I don't know, like a public health officer job or whatever you really want, you are missing out on all the experience that maybe you didn't apply for that adjacent job. So I guess like an example would be, nobody might think that this is like a public health job, but I worked as an event coordinator for I think a summer because I did like a summer 4 year, 5 year kind of like internship as an event coordinator. And at first glance, you might not think that event coordination has anything to do with public health because it was just for the university. I was an orientation event coordinator, so that meant that I worked with the senior event coordinator, and we like put together the orientation week activities for all the incoming students. And that sounds very not public healthy. But I will tell you, most of the skills that I started applying to when I actually applied to real public health jobs or health related jobs, I took a lot of my experiences out of that because one, I had a lot of experience working with stakeholders. I worked with multiple companies for creating sponsorship, brand deals, all those things for the university. And I was the sole lead on doing that because our team was so small. So that taught me about budgeting. That taught me about effective communication, persuasive communication. That taught me a lot about like how do you like please stakeholders? How do you look for stakeholders that are actually going to be really great for your organization, but also how do you like pitch yourself to them as well? So that was one thing. The second thing is because it's an event, one of the bigger things that we also had to think about was logistics in terms of like health and safety for students. So are all these like big balloon structures that we're bringing in like safe? And I had to do risk assessments with the risk team at the university. And so I got experience doing that with them. And I had to learn a lot about like how electricity works and like what happens if it's too hot outside, like how do we take care of students while they're at orientation and making sure that they're comfortable. The third aspect of it is orientation is a really important part of any university because as I talked about it in the beginning, is that it is the first like opportunity that students get to be a part of their university, and you want to make sure that it's a comfortable experience, that it improves their well-being, and that's honestly like that's the reason why orientation exists, is to improve like students' well-being and making sure that they're happy going into this new scary transition. So there's a lot of education, knowledge translation, one-to-one mentorship and communication, all those things that I did with students. And when I was applying for like a policy analyst job, for example, and they'd be like, oh, what experiences do you have like with stakeholder management and like an engagement? A ton. And I can take it out of that job and exactly tell you what I did and how many people that I talked to and how I kept, communicating with them and what did my effective communication look like, and how I kept them on board, made sure that they gave us money and like to do the things that we wanted to do. So if you're looking for, I guess, a public health job, I really encourage people to think creatively, and I really encourage people to look at the social determinants of health, because even if you're working at a bank, and I worked at a bank, I knew that I was doing public health work because one of the big things that I talked about with my clients was financial health and well-being. And we all know that finances are really important when it comes to a person's health, and it helps determine what kind of health outcomes that they have at the end, because income is one of them. And so I could draw from my banking experience and talk about it from a public health lens. And that's why I think public health is so cool, because literally anything that you do, you can take a public health lens onto your job. And if you're looking, I guess, more into like the research stuff and you don't have any experience, but you're maybe doing your undergrad right now, I do like encourage you to reach out to professors at the university that you're perhaps at and see if they have any like research temporary positions open, whether they're paid or unpaid. if you have a course, and this is what I did, at Mount Royal University, you got to do like a directed readings course, and that's kind of like your own project. So I did it on clean drinking water. I had to do it from like a scientific lens, but I was able to use public health as an example throughout my research, which I really enjoyed, and I'm really glad that I did that as well. So I just encourage you to think really creatively.
The short answer, yes.
Yeah.
Longer answer, yes, but you have to like really seek out different
Yeah.
opportunities that mightn't be specifically quote unquote public health,
Yeah.
but like finding those different words or positions around that, which I love, or just like thinking about jobs that you're doing in a public health aspect, because as we said, there have many things have a perspective that you can think about in a public health way. And then the last question, well, before I get to the last question, before be sure that you subscribe if you have not subscribed as yet. Leave a like and share this with someone if they've gotten some value from it. If you've gotten some value with, share it with someone who would also get some value from it. And let me know in the comments if you'd like a part two. Maybe we can talk about creatively thinking about jobs as well as interviewing in public health. So let us know if you want that. And the last question from Rachel is, how do you feel about applying to jobs you might not meet all the qualifications for? I haven't graduated with my MPH yet, and I readily feel like I have imposter syndrome. Laugh out loud. And I feel like this resonates with so many people. So how would you respond to that?
I used to be really afraid of doing that. Like I would look at like all the qualifications, be like, oh, I barely scrape the barrel. But something that keeps me going is I remind myself that there's people out there that may have no skills at all or very, very mediocre, but they apply for whatever jobs that are available out there. And I think that's what really gets me going is that we're all just looking for a job. We're all just trying to look for ways to make money. So if you feel like you don't um, like apply for a job because you don't think that they're gonna, call you back and be like, hey, we want to do an interview, their loss. And you just move on from that. Because you're doing yourself a disservice by not applying for it because you never know. The worst thing that they can say to you is no, or the worst thing that they can do is not read it. And it's not like you're getting money taken out of your pocket. It's not like, somebody is going to be like, oh, she's not even qualified. Like nobody cares. Everyone's just trying to find the best candidate, move on with their life, do their job, and try to get their organization running. So I think that's what really like gets me going is that I will apply for whatever, even if I don't feel like I meet the qualifications, because you never know. You never know if you hear back. And there has been times where I definitely didn't meet any of the qualifications, but I got an interview still, and I was like, sweet, like let's just see how this goes.
That's awesome. And Rachel, love that she said good point, and then the laughing emoji. So she definitely resonated with that and appreciates that. And I appreciate you coming on today, Kaman, and sharing your insights. And I will be sure to have you back if that's what the people want. But love chatting with you at any time, and I appreciate you a lot. Before we get out of here, be sure to let people know where they can connect with you.
Yeah, so you can connect with me on LinkedIn. I post weekly, like a weekly newsletter on LinkedIn. It's called Your Guide to Public Health, and it's kind of about my experiences with being an early career professional and just like helping people kind of figure out how to get into it. That's one way. The second way you can connect with me is on Instagram. I think that's where I'm most reachable by people. So it's kaman.mph on Instagram. And then the third way you can connect with me is on TikTok. I'm not an avid TikToker. I'm really bad at it, but I do post content on there. And that is also kaman.mph. So those are three different ways that you can reach out to me if you have any questions.
Okay, awesome. Thank you so much. I will be sure to leave those in the description if they're not as yet. I don't think the newsletter is there, so I will grab that and put that in there. But thank you for hopping on, Kaman, and thank you everyone for joining us. Be sure to share this with someone if you got some value. We will see you some other time. Peace, everyone.
Yeah, thanks for having me.